Now you go into your sound and video.
Recording in progress.
Oh, you might want to stop that. Voice isn't used. Any of my brothers. Well, you better pause this again. I'm screwing stuff up. Okay. You gotta unmute yourself, Mike. We see you, but you have to unmute yourself.
I'm working it.
There you go. And Bill, we know you're there, so you have to unmute yourself.
Yeah, I'm here.
Okay.
And everybody else. Welcome to Missouri.
All right.
I have about 100 people in the driveway that participating as well. So
Oh, that's perfect. We're so glad to hear that.
so are we ready to rock and roll? Call this meeting to order?
Yep, we're ready when you are.
I'm ready. Boom, boom.
All right, Director Stanisic,
Here.
Director Leach,
I'm here.
thank you.
Yep. Any public comments today?
We have no public and nothing was emailed in.
Okay. Well, we'll get started on the discussion items then. So these are some things I was thinking about that might be interesting to discuss. One that I'd like to add, it was just as part of the conversation, is I was just curious as to how the filming went on the Skinny Jeans success story filming. Just an update on that. I don't know if Teresa was going to be hitting that or not, but I happened to think about that. I was looking through my notes and saw that that went on. But we'll start with the communication plan for SiteLogic Q parking lot project. The reason I raise this is that it's going to get noisy and ugly over there. Do we have a plan for, kind of let the public know what's going on to start, and then kind of a status and letting people know how to get in if they have trouble getting? I mean, I just was curious as to how that gets handled on a kind of a major project like that when we have a lot of programs going on.
So right now what's happening is as we're doing our planning meeting with SiteLogic, we're trying to nail down the exact timeline of when we have to be partially closed down, right?
Okay.
So there's a couple of points. We will do a whole groundbreaking ceremony. That's a good kickoff to kind of let the community know.
Good.
In the meantime, Teresa and the team are letting all of our facility users know, all the programs people know, hey, we're going to be closed down for a month. This is what it's going to look like. Certain programs will move over to the admin building. So we'll hold some stuff over here. Most of that's being done directly to the facilitators. And then just overall community announcement will come when we do the groundbreaking. And we don't have a specific date on that yet, because obviously we're working towards identifying when that groundbreaking date will be.
Very good. And then is there plans for kind of occasional updates as, progression or percent completed or expected opening?
Yeah, all of that actually goes through facilities, and then will come from facilities into the board.
Excellent. And then we can communicate out what's appropriate at the appropriate time for the public. So, because you're going to be able to see that pretty good from Mission. So I'm sure we're going to get questions. So better be ahead of it.
Yeah.
All right, cool. Do we have any sense for the timing of that yet? Roughly?
We're looking at somewhere between July and September, with a most likely mid-August.
Gotcha.
Seems to be the initial kind of expectation date.
Okay, cool. Anything else on that topic?
No.
Nothing for me.
All right. This one hit me as well. I don't remember the history on this, but as we end our fiscal year, is there a social media plan and outreach results that's kind of summarized and popped out for the year in review, if you will, for the district? Has that ever been done before? And if not, could we? And if so, are we?
So I would say the closest to what we've done historically, because we didn't have Jasmine yet, was you were stuck with my annual report. which
Okay.
I know Jasmine loved so much because it had so much rich text to it.
It had so much.
Rich text, yes.
So much. So I think for our plan this year, do you wanna give them any of the information that you've been gathering, Jasmine?
I mean, for 2023, I kind of went in and kind of crunched some numbers pretty quickly. In terms of growth average on Instagram, we saw about 10 people follow per month, so we always got an increase
Oh,
there.
yeah.
As well, for Facebook, it was 12 people per month. In terms of profile visits for Instagram, the average was 75 profile visits, so people actually going to our profile. The highest month was July, which was 188. For Facebook, we see more traction. So the average was 334, as well as July being the highest with 646 profile visits. In terms of our website, in total for 2023, we had 600, over 600,000. And September being our highest with 82,000 visits, which I believe correlates with the Eye on Health event that we had, because we had a lot of people registering for that. So
Yeah.
I think that explains why September was so high in traffic on our website.
That's great.
Yeah.
I think it's I like some of the stats we've been rattling around over the last few months of, participants and people that have completed programs. I think capturing people impacted positively by a program. There's some interesting stats developing there that I think would be a nice flash post, if you will, about, what's going on at the district and how many people are being impacted and how the growth of the programs has been from last year to this year. There's a lot of great news in there, and I'm looking at, want to do big text rich posts, but lovely, like some nice billboard type post to show what's been going on for the year. There's some great stuff happening and a lot of growth, and I just think a fiscal year in review would be appropriate. Maybe it's a 2 or 3 post series or something. I don't know. You guys can figure that out, but between the stats and the number of hits and website visits and the people that have been positively impacted and graduated from the programs, the new programs for over last year, a lot of great stuff. And the more we get that out to the community, the more we get some attention and continued support, I think. So I thought before we got to that point, I hit me.
Yeah. Well, I think it's easy enough for us to work on drafting that up. I mean, obviously Jasmine's watching all those and we're gathering stories. So yeah, we'll build that in as part of that. Obviously, what's nice is that we can then take all that and use that in the annual report instead of me creating all that deep, rich text.
We're gonna need some of that deep, rich text.
Anyway.
There's a nice combination there, I think, of both. But there's some definite headlines over this past year that I think we should all be incredibly proud of, and I think we need to pop that out there. I know it happens occasionally, but when you wrap it around a fiscal year in review and the positive results, I think it might get some great attention. So I was kind of wrestling with that last month.
Yeah.
Okay.
I had a quick question. Just wondering, do we have a sense that any of the people that are coming into the programs are getting driven there from any of the social media posts, or are the social media post growth numbers more just a product of people that already kind of know about the programs and then are going on there and following? I'm not sure if you guys have any stats that are indicate any of that.
Yeah, how the new people show up, how they hear of us.
Yeah, I was curious as to if a lot of the new followers are people that just went into a program and then just went on social media and followed, or if we were getting any posts or any word of any posts that generated some people that were newcomers that were just kind of seeing it on Facebook or Instagram or something. Because I think if we get to that point, that would be great for sure.
I think that is happening. People are finding us through our social media and coming to events. We get a smattering of everything. So we get people saying they heard about it from a flyer, from the calendar in the newspaper, from social media. as well as our email list that has, grown. People maybe have been on there and are now finding something they like and stepping out and, participating. But definitely from social media, we have, new people joining us, and we do our registrations on a platform called Eventbrite. And so they are an event platform. So we're also gaining, some from gaining new people at the center from the social aspect of that platform as well. So.
Awesome.
Do we ask those people how they do hear of us when they're joining up?
Oh, we do.
Yeah,
Do we connect those down? Okay.
yeah, so with our new programs, specifically the chair yoga program that the district is sponsoring, as well as the Tai Chi for Balance in partnership with the county. We have been asking people when they do register, how did they hear about the program? A lot of it has been a mixture from emails. Some of it has been from the instructor that's going to be teaching the class. Some of it's social media. Some of it is they were actually at the wellness center and saw Teresa talked about it, or Bianca talked about it. So it's a little bit of everything, but we are collecting that data to see how people are finding out about it.
Okay, sounds awesome. Yeah, it's good to know where we're getting the poll, right? So we can, crank out that one harder. Cool. Anything else on the outreach? Thank you for the update.
I would just say, for me, I would just agree with Director Stanisek. I think that the social media push has been going great. And it is nice to see kind of some of that public relations vision kind of happening out there. All of the events that we do, somebody's taking pictures and we're getting that out. And I think that that's definitely going to get us to the point where, we're creating some synergy and getting more people out there. So it's going real well. So appreciate the hard work, Jasmine and Rachel and Teresa and all the staff for putting in that time.
Absolutely. It's neat to see where we are now for where we were a year ago.
Oh yeah.
Pretty
I
amazing.
remember the days when we would get like maybe one post per quarter. And it would be just a grainy photo or something.
Yeah.
So it's exciting to see and just follow along the page and kind of see everything that's happening and stuff. It's really exciting. So great job.
Yep. Totally agree. Excellent.
I do have one little note on outreach in terms of in person, like getting in front of groups and where we're at. I think I missed a few things that we did, but I have recorded 16 different events that the staff were at, not for the fiscal year, for the calendar year, for the past year. So we are out and about, as well as just being more active on social media.
Great. No, I think, excellent. I mean, being at the events too is certainly beneficial, right? And having us a little board show up once in a while too is helpful, I hope.
Well, it depends sometimes on you guys. I don't know.
I know. You got to use that sparingly because you don't want to mess up progress. All right, last item. Any updates on the Community Health and Wellness Center programs? Obviously, we just heard some good things there, but if there's anything else we need to lay out or talk about?
Sure, just maybe a few key points. You asked about the filming that UCSF did for that state project. It went really well, and we were able to negotiate to get the B-roll footage. I mean, I'm sorry, the raw footage, not the B-roll, the raw footage. So we will have some of their video that we could maybe craft into something of our own. So that was exciting. Yeah, universities usually really like to own that stuff. So we were quite pleased that that worked out. So in terms of what's happening there, we are big time engaging with the public. We are definitely, all the work that's been done in promoting things is coming to fruition. We've had situations where our Tai Chi for Balance class caught us off guard, and we blinked and we had 38 people registered for it. And then we switched it to a waiting list, and we had 24 more people sign up on the waiting list. So it went in one day from one class to two classes.
That's great.
The Tai Chi for Balance,
Those we hit a sweet spot too.
Yeah.
Yep.
So we've been having great turnout at events. There was today we just had a Wellness Wednesday and we had a lot of people there. We had a line of people waiting to get screened. So there's this synergy between the mix of programming, which is great. So we're creating through the other programming a demand for the screenings because people are starting to look at their health and understand the value in that. So that's really great. We definitely are getting more attention from the county and working on those relationships. So the Tai Chi for Balance was a county class. Oh, that's the other one. The nutrition class was from the county, and that one went. We had over 30 people in the class. And we had several Spanish speakers. So this was the first time we tried out a simultaneous translation. I don't know if we'll be doing it again. It's not quite done yet, but I think right now we might prefer to do separate, but we're trying it to see if that was a way to expand our programming in Spanish. So it's been great. Some other good connections are happening. Like Vista Community Clinic is redoing their Promotores program and might be able to have like an office at the wellness center. So, get some more engagement there. Just in the last few days, got contacted by the Mexican consulate about doing a big outreach program at the wellness center. So we're our name is definitely, getting out there. In terms of, new partners and expanding our partnerships. We're going after, Jasmine is spearheading, of applying for a recognition for a CSDA award as well as an ACHD award. So that's
Great.
in the works.
Awesome.
That's really good. Yeah, that's exciting. I just warms my heart to see those types of activities growing, and that's awesome. That's all I'm going to say. Just awesome.
Yeah, we've had a little bit of March Madness. It has been truly like, no one's playing basketball, but yeah, it's been a really fast paced month with all these events. And as we are launching our own district sponsored chair yoga program.
Yes.
I sent Rachel some pictures, but the parking lot we regularly every week more than fill it. So that space down below that looks like a grassy field, that's really just weeds. We've been utilizing that. Yeah. Utilizing it regularly. So,
Nice. That's a nice
And
post too. We got a full parking lot.
Yeah, and before you follow up with a facilities question, Teresa and I have talked about what it would take to maybe scarify and then kind of flatten and compact that area a little bit more, and then either paint or find a semi-permanent way to paint more parking lines down there. That's something that we will have to add in probably sooner into the plan than we had anticipated, but we'll address that after the main parking lot is done.
All right.
And after the rains.
Oh, yeah. Yeah. Well, it's a good problem to have.
Yeah.
Excellent. Well, any other comments or items for
I
future
got
agenda?
one.
Okay, dive in.
So
What I do wrong now?
No, you did nothing wrong. This is actually part of our governmental component of this meeting.
Yep.
CSDA as well as ACHD, Streamline, which hosts our website. I think I've mentioned that they are all working toward establishing essentially a national special district level association. And the goal behind establishing that national level is so that there's a consistent definition of what a special district is, so that when our umbrella entities go to federal legislators, they're not having to try to educate them to what a special district is in Arizona, Arkansas, California, whatever. So right now, the legislation that's being put forward is HR 7525, and it's called the HR 7525 Coalition. We've already added it to our website, and it basically is a piece that, after I talked to you guys in this committee, presuming you were all right, we would push it out to our grantees and to many of our stakeholders so that they can then help to promote to our local legislators to support this national level of recognition for special districts. It would really allow us as a group of entities, potential access to federal dollars, state level dollars.
Right.
The immediate example is when COVID dollars came through, special districts were not initially eligible to apply to receive a lot of those COVID impact dollars. It was only special carve-outs that were essentially hammered into the legislation from special districts nationwide that said, special districts are the hospitals, special districts are the fire districts, special districts are the cemeteries, who ended up all having massive impact due to COVID. But yet we weren't eligible because we weren't the right kind of government. Obviously, this legislation would be able to make that challenge no longer happen in the event of the next national, and or allow us nationally to be able to come together and say all, I don't know, however many national health districts there are, be able to come forward and say, this is legislation that affects healthcare. These are special districts who work in health there. This is our opinion on such a thing.
Right.
So unless you all have a disagreement with that, I'm going to ask our stakeholders to become aware of that special district legislation and to try and help us support it.
No,
And you can find out information about it on our website.
Yeah, it sounds good. I think it gives us more leverage and potentially more communication opportunities and the ability to maybe move faster in some areas. Who knows? But and I think there's a credibility there. It sounds like too, just the way they would lay that out puts another level of credibility on the district and how it works and how they do work.
Yes.
Rachel,
Cool.
there's over 35,000 special districts.
Yeah. And if you put all 35,000 special districts in one association, that's a very loud voice. Now, granted, probably half of those are water districts.
Right.
No offense, Bill. But even that, you know.
Yep. Cool. That sounds good. So the
Bill-
thinking there is that
Bill
we get our
can make
grantees
self-assess.
thinking. The thinking there is we get our grantees aware of this, and then leverage them to help us potentially support whatever initiatives may be coming our way in that regard. Okay,
Right.
gotcha. All right, cool. Any other comments or items of future agendas that we should consider? I haven't worked mine out yet, but any others pop up?
Oh, yes. You know what? I'm gonna turn this one to Jasmine. She just mouthed to me. We finally have outlined and approved a district brochure.
Woo!
Oh, great.
So
Awesome.
Jasmine, why don't you discuss that?
Yeah, so I know it was one of my initial projects when I first started here at the district last June. The task was to pretty much take the website and turn it into a trifold brochure that we can kind of leave as a leave behind. We could put it at the Fallbrook Chamber of Commerce, and it's just that one that would pretty much sum up what the district is. So it kind of has our mission, vision, and values, who we are. It labels both addresses of where we operate, and then it talks about what we do. Specifically, I made sure to touch base on the community health contract grants as well as the youth fitness grants, the joint partnership with North County Fire Protection District, as well as tie in the Community Health and Wellness Center to make sure that people know that's still underneath the Fallbrook Regional Health District and it's not its own separate entity. We also did some program highlights that take place at the Wellness Center. And then our lovely section that went through a couple trial and error is the medical centers and services, which is pretty much kind of talking about clinical services and addresses the hospital and urgent care. And I put a bunch of QR codes. That way this stuff will be out of date, as well as I did a quick frequently asked questions, what communities do we serve? Where do taxpayer dollars go? Are there fees associated with our programs and ways that people can get connected?
Oh, nice.
In terms of if they're looking for basic needs and services, as well as our office hours, but kind of the slogan we kind of went with was invest in your health, and we are the most responsive form of local government. And I also tied in that we've been serving the Fallbrook, Bonsall, Rainbow, and Duluth communities for over 70 years. So it's kind of, I took at the beginning, I kind of threw the kitchen sink at this brochure, and then I went back and forth with Rachel and Teresa to see what should be included, how should we word it so that it doesn't become outdated within a year, and that this could be something that we're just kind of updating our website, and this brochure still is concurrent. But yes,
It's awesome.
this is the lovely brochure.
Great.
We will be updating the photo for the Welcome Center. Teresa did order a planter, so we'll stage it a little bit prettier. It was a quick shot just to have a placement what we wanted the image to be.
Where's the QR code for the 1-minute introduction from our illustrious CEO?
Oh, that doesn't exist.
Next year, we'll get it next year.
It's called the website. There's so much.
It's just, lots of words and pictures, but when you get somebody talking about it with passion, that's when it gets exciting.
I nominate Mike. Do I have a
Okay.
second?
I second.
Sign
I
me
have a
up.
second. All in favor?
Let me know when.
Okay.
Sign me up. Let me know when. You got till November.
Okay. Jasmine, get the mic ready. As soon as he rolls back into town.
Yeah.
Yeah.
Actually, you know what we could do?
She got an idea.
We could script something for all 5 board members, and they could memorize their script. No teleprompters. And then you could link to that to the, elected responsive board government.
Whatever is
stuff.
going to help support you guys have fun and build this organization and create community. Let's do it.
It's like, yeah. It's all good. Never
I'd like
mind
to
the
introduce
chatter.
Bill Leach, our chairman, who's going to talk to you about this wonderful district. Bill, what you got to say?
Exactly.
All right. Hey, the brochure looks great. I mean, I like the look of it. It's got some nice headline approach to it. It catches people's eyes. So this is great. And I think it does have a life there in the way it's laid out. We're not doing this every quarter, which is important. So nice job on this. And I know you guys are working together on it. So I don't know what the process is for sending these things out or getting them approved, but if there's more iterations, great. Just let us know, kind of where we are and when we're going to launch it.
Well, once we finalize that last kind of placeholder photo, we'll print out some copies for the board to present. We'll give you guys one last chance to bless it, and then from there we'll have a significant amount printed. And then that way we'll have it for those presentations that Teresa's done a lot of, I've done a lot of, when
Yeah.
Jasmine's doing all these community outreach events. That way we do have a leave behind.
Yeah.
And then you guys as board members, it's a great thing for you to be able to say, oh, this is what we do.
Yeah, absolutely. Totally agree. It comes up all the time when I'm bouncing around different chamber events and other events that, they hear what I'm, working on this. What do they do? Well, here you go. I was going to get a tattoo of the QR code on my forehead, but it wasn't really a great idea.
See, I've been trying to talk the girls into getting FRHD tattooed on them, but so far.
Not happening yet, huh?
No one's a go except for me.
Oh, okay. Well, maybe that's a strategic objective for next year.
See, maybe it'll be in everyone's performance review.
Yeah.
I'd love to see that go through.
Yeah, let's see how that flies through HR.
So many lawsuits.
So many lawsuits.
Yeah.
Maybe we'll get some temporary ones.
Alrighty. Okay, any other comments? Is Bill still on? Did we lose Bill?
No, we lost Bill.
All right. If there's no other comments, then I move to adjourn this meeting.
All right, we are all done.
You stop
Thank you,
recording?
Mike.
Let me know when you stop recording.
Okay, thank you.
You good?
No,
Hold on.
just 1 second.